Good afternoon, everyone. So no problem. I just had kind of a quick talk to give everyone today, just to introduce the field of surgical podiatry in Pakistan. So we're on a mission to really get this across Pakistan, and we're the first line of service here, and really focusing on limb salvage and bringing the aspect of surgical podiatry here in Pakistan. So my name is Dr. Asim Qureshi. I was brought up and raised in the U.S. and I trained there. And what I really want is to bring what I know and my knowledge here back to Pakistan. So, how this relates to functional medicine, I have a lot of experiences and I lived in different, different cities all over U.S. and I always bring something back with me, and I like to compare this to what I'm learning here. I'm always a student and I'm always learning, and I want to bring everything I can I learn to medicine and podiatry and this very interesting topic of lifestyle and functional medicine. So the most important thing from the slide is what the role of podiatry here in Pakistan is. We know that the foot is really important in our lifestyle. A lot of people have amputations, and ask those people how hard it is to ambulate or how hard it is to live their daily lives. So it's not only from a lifestyle perspective, but also from an economic perspective too. So it's always interesting to see that. One of the things very importantly, fundamentally here is the understanding of chronic diseases. Here in Pakistan, we have the highest prevalence of diabetes in the world. Why? Because again, as everyone has spoke in the past here, and we had some great talks and some understanding in the medical realm, Pakistan is very challenged in a lot of ways, especially from a dietary standpoint and a lifestyle standpoint, and there's a lot of external factors. So again, it's important to always take a look at our foot, in terms of just that part of your lifestyle. Again, preventative foot care is the best, right? Always look at it. I always tell my patients this. An important thing that I always look at from a clinical standpoint is biomechanics. I look how my patients are walking, what kind of shoe gear they're wearing. So I wanted to always raise awareness to this. A lot of times people, they wear really, a bad shoe gear, and it's not their fault, they just don't know. And sometimes that causes to a lot of problems. It gives them a blister, it leads to a wound, and next thing you know, they're coming in for an amputation. So I always kind of talk to them about this aspect as well. Here's a quick timeline kind of how podiatry started. From 1912, the first school of podiatric medicine opened in New York City, and from where we expanded modern surgery all the way, where we're getting recognized, the diabetic foot, we're recognized as a global, a problem. And, in Pakistan, we know it's a high amputation rate. And today, I think, knowing all that and the advent of technology, and we have the ability to utilize AI at our fingertips, we can really bring the field to understanding that it's accessible to everyone. So here at Ziauddin Hospital, they asked me to come and start a program for them, and what I really wanted to do was bring the aspect of minimal invasive surgery here. And the importance of this is that these concepts were taught and trained in the Western world, but here they're new, and if we can do it and bring the cost down for a patient, great. A small example I had a patient that came into the office the other day. There's a very famous university here that had quoted the patient 11 lakhs per the procedure, and in my office I was able to do the same exact procedure for 10,000. Okay, so the point is we're bringing the cost down in healthcare, and that's the most important part of my journey here as a foot and ankle surgeon and a podiatrist, is to bring this approach throughout Pakistan. We're starting here in Karachi, and we're going to be expanding all the way to Lahore and Islamabad. So again, quick little picture here, minimally invasive bunions, very cost-effective procedure. We can correct a bunion with 2 pinhole incisions with very minimal pain, and we get the patient walking in 1 week. So again, some aspects of what we're bringing to here. Another thing important, we talked about this in the past, a lot of people are focusing on this. We know that the population is aging. We know that there's lack of physical activity here, and oftentimes I'm a culprit of this in myself, and and it's so important, as we had great talks on gyms and great talks on epigenetics and everything, and we need to understand, foot health is also a huge part of our lifestyle and our physical activity. Again, here's a quick slide on, diabetes here in Pakistan, silent killer. Again, highest prevalence in the world. I mean, our population is less than China, it's less than India, but again, look, we're number one across the board for diabetes. So again, we need to just think about this from a lifestyle and functional medicine perspective, and think like, okay, screening at primary care levels, referrals and everything, okay? So again, quick kind of slide that's kind of important to show graphically. We need to bring public awareness campaigns, outreach, and that's kind of what I'm doing now. I'm just going everywhere across, and talking about the field itself, and I'm training, students now as we speak. So it's all important in the whole realm of, bringing lifestyle into, our daily application. And again, I really think that podiatry is a super important aspect for me, and basically the takeaway here is we need to be thinking about these conditions at a primary care level, at the home, with our diets, with a lot of aspects in medicine, because remember, prevention is the best medicine. Thank you so much, guys. That's all I have for you today.